I'm Dr. Jeff Kieliszewski, forensic psychologist. Welcome to my YouTube channel. By now, most of you have probably heard of the term psychopath, sometimes also referred to as sociopath in the research literature. I was asked a question by one of my YouTube subscribers. Is there actually a psychological test that you could use to determine if someone is a psychopath? Well, the short answer is yes. Yes, there is. But before we get into that, we need to define what we mean by psychopath. And there are a lot of different definitions out there. We're going to talk about a psychopath as a person having a mental condition that's called psychopathy. Probably one of the better definitions that I've seen of psychopathy is a mental health condition characterized by persistent antisocial behavior, impaired empathy, a lack of remorse, and tendencies towards bold, disinhibited, and egotistic traits that are often masked in a superficial charm and show the outward presence of apparent normalcy. Psychopaths are also frequently referred to as social predators, sometimes remorseless predators. You could think of psychopaths as not having a typical emotional connection to other people like most of us do. There was a great study that was conducted in the 1980s where they took a bunch of psychopaths and non-psychopaths and they sort of put them in these kind of small movie theater setups where there was a screen and they would project certain words onto these screens, and the words were accompanied by audio of the word. The words that were selected were words that often solicited strong unconscious physiological reactions in people. For example, it could be a racial or ethnic slur or some other emotionally loaded words. Now, some were even positive words like love, baby, things like that would elicit more of a positive emotional response. Now, the subjects had physiological monitors measuring their heart rates, galvanic skin responses, other things like that. Non-psychopaths would show significant physiological response to these words. Psychopaths would show little or no physiological or emotional response to these emotionally loaded words. I heard one well-known forensic psychologist describe psychopaths stating, "How can a psychopath so easily cut up a body for someone they murdered?" Well, for a psychopath, cutting up a human body doesn't offer any physiological response. For most of us, if we had to cut up a human body, we would likely have a physiological or emotional response. So for a psychopath, cutting into a human body is sort of like cutting their chicken sandwich in half for their lunch. There's no emotion attached to it. The concept of psychopathy was first conceptualized in clinical terms by an American psychiatrist named Hare PCL-R in his 1941 book, The Mask of Sanity. He used the idea of a mask, arguing that most psychopaths can appear normal, but under this mask of normalcy lies a potentially dangerous mental illness. In the 1970s, a Canadian forensic psychologist named Robert Hare started to develop a way to measure psychopathy, partly based on his work with male inmates and forensic inmates in the Canadian prison system. Out of his work, the Hare psychopathy checklist was developed, now commonly known as the PCL-R. I was fortunate enough to attend a workshop with Dr. Hare in the late 1990s to be trained how to use the PCL-R. Now, Hare said originally he developed this instrument and wanted to give it away for others to use it for research. He originally developed the instrument with the intention to try to establish a DSM diagnosis for psychopathy as sort of a subset from antisocial personality disorder. But he soon realized that his instrument that he was developing could be used as a clinical instrument and possibly utilized in how to manage correctional populations. For example, to use it for trying to determine parole eligibility sentencing. Now, the PCL-R is a psychological assessment tool that consists of 20 items a professionally trained clinician rates on a 3-point scale. The examiner uses the results of clinical interviews and also a review of records, police reports, mental health treatment records, school records. Some examples of these particular factors that the examiner would look at would be things like grandiose sense of self-worth, parasitic lifestyle, callous lack of empathy, shallow affect, glibness, superficial charm, promiscuous sexual behavior, early behavior problems, juvenile delinquency, criminal versatility. So in the manual, these are described in great detail and also described what particular criteria you would apply in order for this to be to score as a 1 or a 2 or a 3. Then a total score is calculated. The score essentially establishes the presence of psychopathy and the level of psychopathy. Now, there has been extensive research on the PCL-R utilizing pretty complex statistical analysis, and it was found over and over to be a fairly robust and valid instrument when it's administered correctly. Now, how is it used and how have I used it as a practicing forensic psychologist? The main use nowadays is as a clinical instrument as part of a forensic evaluation to examine risk to reoffend in violent offenders and also sexual offenders. As you can imagine, in the research, psychopathic sexual offenders present as a higher risk to sexually reoffend against others. Now, in the Canadian prison system, for a number of years now, the PCL-R has been used as part of a standard protocol utilizing forensic risk assessment for sentencing decisions, but also for parole eligibility. So often, the higher the score, the more likely you'll be sentenced to prison versus probation. The higher the score, more likely you'll get a longer sentence. And often higher the score, the less likely you're going to be able to get parole, particularly early parole. Now, in the United States, we don't use the PCL-R. We don't really have protocols the way they do in Canada. The Canadian prison system is a federal system. Here in the United States, we have 50 different states, and different states do different things, and I've even seen variability within jurisdictions. So there's not a sort of a standardized approach where you would do a risk assessment or use a PCL-R in order to help determine sentencing. Now, how have I used the PCL-R as a practicing forensic psychologist? I mostly used it for forensic risk assessment and sentencing decisions, and sentencing decisions in violent or sex offense cases. Now, when I worked as a correctional psychologist in the Michigan Department of Corrections, I would use the PCL-R in treatment selection. So when I was a psychologist with the MDOC, I would run sex offender treatment groups. Also, there was also some individual component where I'd work with convicted sex offenders individually as part of their treatment as well. Now, in Michigan, we have indeterminate sentencing, which means your sentencing is a range. For example, you could be sentenced to 5 to 15 years. That means the earliest you'd be eligible to apply for parole was at 5 years, but that the system could keep you 15 years. Now, in order to be considered eligible or apply for parole with a sex offense, you would have to have successfully completed the sex offender treatment program through the Michigan Department of Corrections in prison. So what I would do is in my pre-treatment screenings, if I saw data or evidence that would suggest potential psychopathy, I would administer the PCL-R. Why? Because there has been some very well-established research that argue that putting psychopaths through treatment like the treatment that we offer, the sex offender treatment, may actually make them more dangerous. They sort of become sort of better equipped predators. They learn to know what to say and what not to say to evaluating clinicians, to law enforcement, and to the general public, which would actually make them more able to victimize others and avoid being caught. So if I found a high score on the PCL-R, I would make them ineligible for my treatment, and I would argue I'm not going to provide a treatment that would make an offender more dangerous. As you can imagine, this caused a bit of controversy. I had inmates that were filing formal grievances against me because if they couldn't complete the treatment, they weren't eligible for any parole. So I had to write up all of my reasoning behind this, in response to the grievances, and I cited the science, and I cited the use of the PCL-R, and I was never overturned in my treatment decision, and there were a lot of guys that weren't very happy with me, but I would argue that because of this screening and because of my knowledge of psychopathy and sex offending, they stayed in prison a lot longer, sometimes even decades. And I would argue that made the public more safe. Anyway, if you have an interest in forensic psychology or true crime, subscribe to this channel. I'm also on other social media outlets, TikTok, Facebook, X, and Instagram. Everything's under Dr. Jeff Kieliszewski, forensic psychologist. Thanks.